Hello everybody, I'm Dr. Anders, Dr. Ron Anders from Coldwater, Ohio at County Animal Clinic. We're here to do a webinar on doing a traditional Chinese medicine diagnosis on a horse, how I'll go about treating a horse that basically has any kind of issues or anything going on with it, anything from lameness to digestive issues to skin problems. We can do all this with acupuncture. When I approach a horse, I'm basically looking for what kind of problems this horse may have, what kind of issues she has. She doesn't have a lot of issues and stuff. She's got a couple little minor things, but we're going to show you what I'll check her to see what's going on and what is out of balance and what seems to be an issue that we need to treat. First thing off is I will first look at her tongue and her gums. I look at how she's standing and see if she's standing square. What I'm going to do is I'm going to do a tail pull, and we're going to basically get her to adjust her sacrum. And she's going to do it herself, but this can be sometimes very painful. And so this can be dangerous if you don't know what you're doing. You can actually fracture their sacrum. You can actually fracture their pelvis if it's not done right, or even break their tail. So what I'm doing is I'm going to pull back. I'm just going to pull gently on her. And I just felt her sacrum move right there. So where this sacrum was very sore here before, see this? She's not flinching. Now the other thing is, see her stifle. She's not flinching for her stifle either. It's because of this right here. Now we're going to adjust her neck here. Say we see that her neck is out right here. So what I'm going to do is I'm going to adjust her neck. So I'm going to lay her head right here on my shoulder. Just get her to just relax. So I'll kind of get her at an angle here so you can see a little better. Basically, I got my hands over the top of her pole. Wait till she relaxes. Then pull down. Bring her head the other direction. Bring it down. Pull. And what I want to do is make sure that this thing gets lined up properly. So, cool. Now we're going to put some needles in her feet. So I'm starting this foot first. So we got one right here and one right here I need to put in. So I'm going to put one right here. And the common question is do you get kicked with these? Yes, you can. And you'll notice the one in the middle of her back foot is actually dripping fluid. That fluid is basically because you've got fluid accumulation across that stomach channel. Remember me telling you the spleen meridian comes across the inside of the stifle, the stomach comes across the outside of the stifle. She was sore in the stifle. That indicates that there's definitely some soreness there going on in that stifle. So we start up here at the head. She's anticipating this is going to hurt because it probably has hurt for a little bit. But see, it's like, oh, it doesn't hurt now. And some of these you have to take and just massage this behind the ear. And when you massage this just a little bit and stuff, you'll just see them just relax down. There's a point right here at the jaw that sometimes these horses have their neck out, and they also have TMJ, temporomandibular joint right here. So what happens is they have problems chewing, and they may have problems with their jaw. So sometimes this point right here will be really tender. You can just put your thumb in there, and they will throw their head violently because it hurts. You come down along the neck, see no reaction. Come down here, no reaction. See that? Here's the liver point. Remember how reactive she was before? And see, she's licking and chewing. It's like, oh, that feels good. And this go down here for this stifle. See, no reaction across the stifle now. So what I'm going to do now is I'm going to put some needles in her to balance her out acupuncture-wise. We've got her all chiropractic adjustment. Now, before we do anything more, I want you to see her tongue and gums now. See, her tongue and gums have changed. The tongue is not so lavender. The gums are a little more pink, and the tongue's a little more pink than what it was. So that's a good sign when we get that. That means we're getting things more in line and balanced like they're supposed to be.